So today we are discussing about cardiovascular system. Cardiovascular system basically summarized into two parts. Number one, cardiovascular system of heart physiology and the vascular physiology. So first of all, we will discuss about the layers of heart wall. Layers of heart wall are divided into three layers: pericardium, which is outer layer, then myocardium, which is middle layer, and the third one, endocardium, which is inner layer. Pericardium, which is outer layer, is the outer covering of the heart. It has further two layers: outer parietal layer, inner visceral layer. The space between these two layers is called pericardial space, and it contains a thin film of fluid. Now outer parietal layer is further divided into two layers: fibrous layer formed by thick fibrous tissue and serous layer formed by mesothelium and the squamous cell. Now second, middle layer, myocardium. It is a middle layer and formed by cardiac myocyte or cardiac muscle fibers. Myocardium has three types of muscle fibers: muscle fibers which form contractile unit of heart, muscle fibers which form pacemaker, muscle fibers which form conductive system. Now endocardium, inner layer. It is the innermost layer formed by a single layer of endothelial cells. It lines the inner surface of heart. Now action of heart. Chronotropic action. Chronotropic action simply means the heart rate. It has two types: tachycardia and bradycardia. Inotropic action. Inotropic action means force of contraction. It has two types. Number one, positive inotropic, that is increased force of contraction. Negative inotropic, that is decrease in force of contraction. Dromotropic action means conduction of impulse through heart. It has two types: positive, increase in the conduction velocity; negative, decrease in conduction velocity. Bathmotropic action means excitability of cardiac muscles, and in the same way it may be either positive bathmotropic or negative bathmotropic. Now autonomic control of heart. Autonomic control of heart further categorized into sympathetic and parasympathetic. Sympathetic system basically वर्क करता है ऑन बीटा 2 रिसेप्टर एंड न्यूरोट्रांसमीटर जो है इसमें नॉरएपिनेफ्रिन है, और इसका बेसिकली फंक्शन ये है कि हार्ट रेट को इंक्रीज़ करता है, कंडक्शन वेलोसिटी को इंक्रीज़ करता है, डेट इज एवी नोट, और कॉन्ट्रैक्टिलिटी को इंक्रीज़ करता है. नाउ द अदर साइड पैरासिम्पैथेटिक में रिसेप्टर हमारे पास है मस्कुलिनिक M2 रिसेप्टर, न्यूरोट्रांसमीटर है एसिटाइलकोलिन. ये बेसिकली हार्ट रेट को डिक्रीज़ करता है, कंडक्शन वेलोसिटी नोट को डिक्रीज़ करता है, कॉन्ट्रैक्टिलिटी सिर्फ और सिर्फ आर्ट्रिया में होती है जो कि डिक्रीज़ होती है. नाउ आयनिक मैकेनिज्म ऑफ ऑटोनॉमिक नर्वस सिस्टम. First of all, parasympathetic decreases heart rate by decreasing rate of phase 4 depolarization by decreasing if the inward current responsible for phase 4 depolarization in SA node. इसी तरह sympathetic में आप देखिए increase heart rate is by increasing the rate of phase 4 depolarization. ठीक है. It means positive chronotropic effect is accomplished by increase if the inward sodium current that's responsible for phase 4 depolarization in SA node. Now second point, decrease in conduction velocity through AV node, decrease inward calcium channel, increase outward potassium current. Second point, sympathetic का increase in conduction velocities by increased inward calcium current. Okay. Okay, point to be noted, atria, SA node and AV node all have parasympathetic supply, okay, but ventricles do not. ओके सेकेंड ये है कि कंडक्शन वेलोसिटी फास्टेस्ट होती है इन परकिंजी सिस्टम एंड स्लोएस्ट इन एवी नोड. नाउ आई एम गिविंग यू रिव्यू हेयर. An inotrope is an agent that alters the force of energy of muscular contraction. Negatively inotropic agent weaken the force of muscular contraction. Positively inotropic agent increase the strength of muscular contraction. Now the effect of agent. Basically, inotropes affect myocardial contractility and enhance stroke volume. So chronotropic agent affect heart rate. Lusotropic agent improve relaxation during diastole, and dromotropic agent affect the conduction speed through AV node, increase heart rate. Bathmotropic agent affect degree of excitability. Activation of sympathetic nerves to the heart increases heart rate. Positive chronotropy, contractility, positive inotropy, rate of relaxation and conduction velocity, positive dromotropy. Okay, parasympathetic effects are opposite. Parasympathetic effects on inotropy are weak in the ventricle but relatively strong in the atria. When the body activates the sympathetic system, it generally down-regulates parasympathetic activity and vice versa, so that the activities of these two branches of the autonomic nervous system respond reciprocally. In blood vessels, sympathetic activation constricts arteries and arterioles, resistance vessels, which increases vascular resistance and decreases distal blood flow. When this occurs through the body, the increased vascular resistance causes arterial pressure to increase. Sympathetic induces constriction of veins, capacitance vessel, and decreases venous compliance and blood volume, and thereby increases venous pressure. The overall effect of sympathetic activation is to increase cardiac output, systemic vascular resistance, both arteries and veins, and arterial blood pressure. Enhanced sympathetic activity is particularly important during exercise, emotional stress, and during hemorrhagic shock. Okay. The action of autonomic nerves are mediated by the release of neurotransmitters that bind to specific cardiac receptors and vascular receptors. These receptors are coupled to signal transduction pathways that evoke changes in cellular function. Understand? SA nodal action potential are divided into three phases. Phase 4 is the spontaneous depolarization that triggers the action potential once the membrane potential reaches threshold between -40 and -30 mV. Phase 0 is the depolarization phase of the action potential. This is followed by phase 3, repolarization. Once the cell is completely repolarized at about -60 mV, the cycle is spontaneously repeated. Now, atrial myocytes, ventricle myocytes, and Purkinje cells are examples of known pacemaker action potential in the heart. Because these action potentials undergo very rapid depolarization, they are sometimes referred to as fast response action potential. Unlike pacemaker cells found in nodal tissue within the heart, non-pacemaker cells have a true resting membrane potential phase 4 that remains near the equilibrium potential for EK. The resting membrane potential is very negative during phase 4, about -90 mV, because potassium channels are open, potassium conductance and potassium current are high. Phase 4 is associated with increased potassium conductance, which causes outward directed potassium current. In other words, positive potassium ions are leaving the cell and thereby making the membrane potential more negative inside. At the same time, fast sodium channels and L-type slow calcium channels are closed, so sodium and calcium inward currents are very low. When these cells are rapidly depolarized to a threshold voltage of about -70 mV, there is a rapid depolarization, phase 0, that is caused by a transient increase in fast sodium channel conductance through fast sodium channel. This increases the inward directed depolarization sodium current that are responsible for the generation of these fast response action potential. At the same time, sodium channels open and potassium conductance outward directed. Potassium current fall as potassium channels close. These two conductance changes move the membrane potential away from EK, which is negative, and closer toward the equilibrium potassium potential for sodium, which is positive. Now I am ending my video. Hope you will like it. Kindly like, comment and share, and please don't forget to subscribe my channel. Allah Hafiz.